Hi, I am Dr. AKP. In this video, I am going to talk on a special topic on warfarin, a rare complication that occurs from a simple cough, but it can bleed inside your abdomen. This condition is called rectus sheath hematoma. So, rectus sheath hematoma is usually rare. It is usually seen on patients who are taking anticoagulant therapy. So, what is rectus sheath hematoma? It is the accumulation of blood within the rectus abdominis muscle sheath. Rectus abdominis muscle is located on our anterior abdominal wall, and it is covered usually by a rectus sheath, which is an enclosed space. And in this enclosed space, the rectus abdominis muscle is supplied by the inferior epigastric artery. So when you have any kind of strain, you have a uh, very vigorous cough, or you are straining when you are taking heavy weight or any weight lift, then your intra-abdominal pressure increases. And as you are on anticoagulant therapy, your blood supply, the inferior epigastric artery, it can rupture, and inside the rectus sheath, it can bleed. So it is usually rare but increasingly recognized in patients with anticoagulant therapy. As you know, anticoagulant therapy usually uh, inhibits the clotting factors. Mainly warfarin is dangerously causing this condition. The risk factors are elderly. Elderly people usually have uh, tendency to bleed, and it is usually observed in female who are taking anticoagulant warfarin. So we have INR investigation test. In INR, when it is increased, you see that the therapeutic window is here very narrow. So when you have below this therapeutic window, the INR level get down, and subtherapeutic level, you may have clotting inside your blood vessel. And if this therapeutic window beyond which the high INR more than 3, the warfarin levels inhibit the blood coagulation factor in a manner that you may bleed when you stressed, your intra-abdominal um, pressure got increased while you are coughing vigorously, or you have COPD, and you have any other respiratory condition such as located in this picture, and you have recent abdominal trauma. It can even bleed without any kind of such these risk factors spontaneously. We know the warfarin inhibits the vitamin K dependent clotting factors, which are 2, 7, 9, 10, and this warfarin impair the hemostasis level in our blood vessels. So, any kind of minor trauma or increased abdominal pressure, vascular fragility can lead to bleeding. Clinical features we are going to expect that when you are on anticoagulant therapy and suddenly you develop pain and swelling in your abdomen, you need to remember that any acutely developed pain and swelling on abdomen is dangerous. And while the chronic swellings or pain may refer to any kind of tumor or other intra-abdominal pathology, but acute conditions are often treated as an emergency. So you are going to look for some bruising on your belly here. Uh, Bilateral abdominal bruises are present, and it is also present in the flank and on the posterior abdominal wall. So when you realize this sudden localized abdominal pain, it is usually present in the lower abdominal quadrant in many kind of patient, and it is usually unilateral swelling. Yes, you have also noticed there is a palpable abdominal mass which can be sometimes firm or which can be fluctuating, and you have associated possible nausea and vomiting. And if you also feels dizzy, then the intra-abdominal blood collection is usually huge, so you may lose intravascular volume and you may develop a septic shock. Sorry, it's not septic shock, it is hypovolemic shock. Signs: ecchymosis over the abdominal wall. This is known as Cullen sign or Great Turner signs. Is if the large hematoma is present, and fluctuating mass and abdominal rigidity, which may be absent in this case because the intra-abdominal pathology is absent here. And what are the investigations where we can look for this kind of bleeding to um, diagnose? In laboratory, complete blood count shows anemia because you are bleeding internally and your INR level is usually high. It is well above 3. And if you have 3 or more, you are going to make it more risky. And you also need to know the renal function test. If you are going to bleed internally and your myoglobin hematuria is present in your blood. On imaging, uh, your doctor may do an ultrasound test. It is usually done bedside. On POCAS test, it is good for initial detection because you have a little amount of time and you need to react is as soon as possible is before it makes you hemodynamically unstable. And CT scan with contrast is the gold standard for diagnosis because we know the extent of the extent and size of the hematoma, and any other intra-abdominal bleeding is absent or present. This is a picture showing your hematoma on the right side, and in CT scan you may uh, see this kind of bleeding and its extension. Okay, these patients have bilateral rectus abdominal sheath hematoma, and the right sided bleeding is much larger than the left side. Okay, and the classification, which is known as Barner classification, it is based on the uh, size of the tumor and where it is extended. The type 1 is usually intramuscular and small. It is minimal symptoms and usually it is self-limiting. Type 2, moderate and within the muscle, and it can extend above and below between the sheath layers. And also the type 3, which is the more dangerous condition, and where your blood hematoma can extend into the pre-peritoneal space, and where you are going to lose a whole lot of blood and you may develop hypertension or significant pallor that indicates your anemia. And how we manage it? It is managed. It it is managed in if the patient is hemodynamically stable, you have lower amount of bleeding, and this is seen in type 1 and 2. Your INR level usually goes up when this condition develops, so you need to adjust or stop the warfarin what you take regularly. And if your INR is much elevated, then we usually infuse cryoprecipitate concentrate or fresh frozen plasma because this acts faster within hours. And you are also given vitamin K, but it needs days to recover your clotting factors 2, 7, 9, 10. Okay, and we also give analgesia to reduce the pain and take rest if the patient is not dizzy, and serial monitoring of hemoglobin should be done for assess the anemia levels and vitals. And if the patient is hemodynamically unstable, such as in type 3, where a lot of blood is usually lost, and for hemodynamic compromise prevention, we need to admit the patient in ICU care, and blood transfusion is already needed. And if we do not get to stop the bleeding from inside the rectal sheath, we can do an type of interventional radiological procedure where we embolize the bleeding blood vessel, and we can also do surgery if it is uncontrolled. And usually it is not often required, but if you develop a large hematoma, then you need to do surgery. And you need to know the complications that develops in rectal sheath hematoma. If you lose massive blood volume, then hypovolemic shock is developed, which I have discussed earlier. And inside this rectal sheath hematoma, you can also develop infection or abscess formation, and rarely compartment syndrome develops. In this patient, we can see the compartment, abdominal compartments usually got infected, and compartment totally is having swallowed, and intra-abdominal masses can be sometimes involved. And if you are taking this anticoagulation again and again, then you might develop the recurrence of this rectal sheath hematoma. And for prevention, we need to maintain the therapeutic INR level below 3. And most indications, we can see that it is between 2 and 3 levels are should be kept and maintained. And careful monitoring in elderly or patients with comorbidities, such as who have hypertension or who have obesity, and female patients who are taking multiple polypharmacy drugs can develop this rectal sheath hematoma. And also educate the patient for avoiding the trauma or intense training. You may strain while you have constipation, you may strain while you are going to the gyms, and while you are having heavy weight lifting, you may develop this condition acutely on a sudden procedure. Okay, so this is my today's lecture. If you like this video, you may subscribe and also share this video for my channel. Thank you.